It's the Pregnant Show with me, Euphemia Koleki. Most of the times we go through a lot of issues and problems that exposes us to many psychological problems. Pregnant women are not left out of these issues. They have a lot of things to go through. They have a lot of complications coming in. They have a lot of pressures from society. There are a lot that they go through. Even before one becomes pregnant, there are a lot of things a woman goes through before becoming pregnant. And it exposes them to a lot of things. Depression is not left out of the issue. It's not left out of the complications. And it's not left out of the conditions. Again, it's the Pregnant Show with me, Euphemia Koleki. Today, or this month, we are looking at depression. The whole of this month has been dedicated to look at pregnancy, depression, and see how much we can prevent it or manage it among ourselves as women. How much we as a society we can help our women not to go through depression. With me in the studio is Miss Mabel Kabute, who is helping us do the discussion throughout the month. This month there is for depression. So we are looking at everything depression, and she is doing us the honor, helping us do the discussion. Miss Mabel, you are welcome to the show.
Thank you.
We know of Miss Mabel, but we don't know who Miss Mabel is.
Oh, okay, thank you. So I'm a senior mental health nurse and then
Okay.
international certified addiction professional.
Hey,
Yeah.
meaning you have a lot of assignments going.
Yeah.
Once again, you are welcome to the show, Sister Mabel.
Thank you.
Okay. So on the Pregnant Show, or here in the Pregnant Quarters, we've dedicated the whole of this month to discuss depression, because we've realized that most of the times we suffer depression knowing or unknowingly. Some of our women too suffer depression in pregnancy, and managing them is quite a challenge. And the way society also handle somebody who is depressed. So we are here on the Pregnant Show throughout this month with you to do the discussion on depression. You are welcome once again.
Thank you. It's good to be here.
Yeah, thank you for coming. Please take us through what depression is.
Okay, so depression is a mental health disorder that is characterized by depressed mood and then anhedonia. When we talk about anhedonia, loss of interest or loss of pleasure in activities, which happens within a duration of 2 weeks to 4 weeks and beyond.
Okay.
Yes. So that is basically what depression is about.
So basically, does it affect only men or women, or it affects everybody?
Depression affects both sexes. So it's not gender based.
Okay.
Yeah. So everyone can suffer depression.
Okay. What are some of the things that make us depressed? Or what are some of the things that causes depression in us?
Okay, so we'll look at somebody with a history of family history of depression. So if mom has depression, dad or siblings, grandmother somewhere, it could affect the individual as well.
Okay.
So you stand a chance of suffering from depression if there's this history. And then also life challenges, trauma. People go through a lot of trauma in life, such as loss of job, divorce, a lot of issues that make people suffer depression. And then also we could also look at age.
Okay.
For instance, when you look at pregnancy and depression, the age, somebody who is younger, giving birth or going through pregnancy is likely to suffer depression more than somebody who is much older. Yes. So we could also look at that one too. And then also we could look at I spoke about situations or trauma in life. Yes. So we could look at marital conflicts.
Exactly.
We could look at marital conflict could also cause depression for a lot of people. And there are other risk factors, which we look at hormonal changes. When a woman is pregnant, the hormonal imbalances could cause depression. And then self-image. People who who feel that they are not beautiful, they are not attractive, who look down upon themselves. Yes, such people could also suffer depression if they are not well managed. Yeah.
Here on the Pregme Show, we discuss issues related to pregnancy, labor, and delivery. Therefore, we want to channel our conversation of depression towards pregnancy, labor, and delivery. But before we start that discussion, when it comes to depression, do we have varieties, or is just depression? Anyone that suffers depression, you classify the person as depression from your profession or from where you see it?
Okay, so we have various types of depression. We have the major depression. We have the postpartum, that is related to women and pregnancy, depression. And then we have the bipolar disorder. It's also a mood disorder. That is also there. So we have various types of depression.
Here on the Pregme Show, we talk about pregnancy, labor, and delivery. So we want to channel our discussion towards depression in pregnancy and after pregnancy. When it comes to women, can they suffer depression before they become pregnant and after they have delivered?
Yes, so women suffer depression before pregnancy, during pregnancy, and then after delivery also they suffer depression.
Meaning when the person is pregnant, she can also suffer
depression. She can suffer depression.
Oh, okay.
Yeah. So it happens that way to some women. Yes, they go through such situations during pregnancy. Some before pregnancy, they already have the history of depression due to life circumstances beyond their control. They suffer it. So during pregnancy, it continues into the pregnancy. And then after delivery too, if it's not well managed, it can extend. So
I'm asking this question for a friend or for a reason. Let's say somebody who is not depressed, gets pregnant, doesn't want the pregnancy at the time she realizes she's pregnant. Can she become depressed?
Very, very depressed.
So at what stage of pregnancy do you diagnose the person of depression?
Okay, so our diagnosis is based on signs and symptoms that we look out for. So if we realize that the person is showing those typical signs and symptoms of depression, then we can diagnose that the person has depression. So it's not just about somebody being sad for like, let's say 1 week or 2 days. No.
You don't classify
those people. We don't use that as a yardstick to say somebody is depressed. So we look at various signs and symptoms, and then we also look at the history of the person. So based on our assessment, then we can say the person has depression.
Can you tell us something about women who suffer depression before they become pregnant? But before you answer that, let's go for a quick commercial break and we'll be right back. Welcome back from that quick break. It's the Pregme Show with me, Euphemia Koleki. And like I said earlier, this month is Depression Month. It's declared as a Depression Month here on the Pregme Show. If you have any question, any concern, anything you want to know about depression, or you want to share your issues, or you want help with us, it's the whole of this month is Depression Month. So kindly follow us so that you will learn more about depression in pregnancy, how you will handle it, the signs and symptoms you should look out for should one occur in you or around you, and how you will be able to manage it. Don't forget how you'll be preventing it. Don't forget to leave your comments and your questions at the comment sections after watching the video. Welcome back again from that quick break. So maybe before we went for the break, we were asking about women who become depressed before pregnancy. But before you move into that one, once we are talking about depression in pregnancy, Can you tell us the types? Do we have types of depressions when it comes to pregnancy?
Yes, we have types. We have the perinatal depression, and then we have the antenatal depression, that is during pregnancy. And then we have the postpartum depression, that is after delivery. Yes, so those are the types of depression and even with the postpartum depression, we still have some types. Yes, we have some types of the postpartum depression that we could talk about. Yeah, we have the baby blues. Yes, the baby blues normally last from 1 day to 2 weeks. Where the woman will experience the signs of depression. And then also we have the postpartum depression, which can last up to 4 weeks. And then we have the postpartum psychosis, which that one is to the extreme. It means that when a woman begins to suffer that type of depression, it means it needs urgent attention. Yes.
For clarification's sake, and then for professionalism, I'm a midwife. You are mental health. Should I have a patient who is pregnant after delivery? How will I differentiate between baby blues and postpartum depression?
Yes, so with the baby blues, like I said, it lasts from 1 day to maximum 2 weeks. That's the baby blues.
After delivery.
After delivery. And then research has shown that about 70% of women suffer baby blues. So baby blues may not necessarily need urgent attention. Yes, if it's well managed, the person can be okay.
By the way, what is baby blues? Is it that the mother become blue or the baby become blue?
No, it's just a term. It's just a mental health term that we use for diagnosis, which signifies the various mood swings and symptoms the woman experiences. Yes, so it's not like your baby will be blue or the mother will be blue.
All right. Then back to our question. How can I differentiate? You were telling us how I can differentiate between the baby blues before I chipped in what a baby blue is.
Yes, so the postpartum depression, which normally happens after delivery. I was talking about the types that we have. Yes, so the first one is the baby blues. And then research has shown that about 70% of women suffer baby blues after childbirth, which is normally, it takes like few hours to 2 weeks maximum for the woman to experience that. And sometimes it does not really need medical attention or treatment. Yes, the woman can be okay on her own if managed well. Then we have the postpartum depression. That one takes more than 2 weeks, months for the woman to experience the depression. That one needs treatment. And then we have the postpartum psychosis. That one is let me say an emergency. It needs urgent treatment. Yes, because it means that the woman has gotten to the extreme of depression, which can, like, psychosis sets in with other symptoms. Yeah.
So before we end this episode, with all the things you mentioned about depression, when someone is frustrated, can the person be depressed?
Frustration can lead to depression.
Really?
Yes, if not managed well, it can lead to depression.
Are they the same? Are the two the same?
They are not the same. Depression is a mental illness.
And frustration?
Frustration is just an emotion, a feeling that we experience when things don't go the way we want. So, but depression is a, let me say, it's a disease or it's a disorder. Yes.
Thank you for coming. So frustration and depression are not
the same. Yes.
You can be frustrated, but you are not depressed. Because sometimes you can see somebody frustrated. We from the other side, where we are not sitting where you are sitting as a mental health nurse, when someone is frustrated, we classify the person as being depressed. By the way, thank you for the clarification and thank you for coming.
You're most welcome.
So viewers, thank you for watching us. It's the Pregnant Show with me, the female colleague. As I said, the whole of this month is for depression. Don't be depressed, okay? We have to get out of depression and live our normal lives. We'll continue on our next episode. Thank you for watching. I want to say thank you for all the crew members and thank you for everyone supporting the Pregnant Show. If you like our video, kindly share it and subscribe to our YouTube channel, The Pegmate Cutters, Facebook, Ifemi Akoliki Ayos, Instagram, The Pegmate Cutters. Thank you for watching.